For millions of Americans, back pain is a simple, unpleasant fact of life. Research shows that roughly 80% of us experience back pain at some point in our lives. For most, it goes away, but for some, it can be chronic. With us this morning on The Balancing Act is Dr. Kaixual Liu, a nationally known leader in endoscopic spinal surgery. And we're talking this morning about chronic back pain, why some of us get it, and what can be done to cure it. Good morning, doctor.
Good morning.
Thanks for being here.
Thank you for having me on the show.
Now, let me ask you, what causes back pain? Sometimes you hear it can be muscles, it can be nerves, or it can be your spine. You say?
Most of the common cause is wear and tear injury.
Wear and tear.
Yeah, it's overuse of the spine from daily activities, from work.
Sports, maybe?
And sports,
something like that?
Yeah,
being a gymnast?
Yeah. Gymnast,
okay.
Yeah.
What about chronic lower back pain?
The lower back is different from thoracic and the cervical spine because it carries the most load of the body. Okay. Every day you stand, you walk, you use your lower back much more than the cervical spine.
And how is spinal pain diagnosed?
The spinal pain diagnosis usually is, you go to the doctor. Doctors take a history and physical examinations, and then these days we have a lot of specific tests, image studies, including CAT scan, X-rays, MRI studies. Sometimes we have to use the specific nerve blocks and specific tests to pinpoint where the pain source is from.
And if somebody has a pain, what treatments can they get for something that's maybe chronic or just severe?
Yeah. So fortunately, most people, the pain, they go away. They don't need specific treatment. Just simple exercise, resting. A lot of people, they do need specific treatments, such as chiropractic treatment, physical therapy, and decompression treatment. Some people use acupuncture, yoga, or whatever. But for some people, if the pain is persistent, and then the patient needs surgery.
And the surgery I want to talk to you about this morning is actually what you do. I was reading here you're an endoscopic spinal surgeon. So what is that kind of surgery? And just tell me about how it's done.
Yeah, the surgeon do surgery. Traditional surgery is open spine surgery. You have a spine, for example, here. They cut from the back or the neck 4 to 6 inches, and rip the muscles off from the back or neck, go inside the spine to do surgeries. That
recovery is long, right?
Yeah. Right now, nowadays, we do everything through endoscope. So endoscope is like a device like this. Surgery is performed through a channel through here. There's a channel through here. And everything's going down through a small tube like this. We have also specific equipment going down the channel like this. So you can see this grasper. They can grab things out. And you have burr, you have laser, everything through this small tube. And
doctor, I'm assuming this is less invasive?
It is much less invasive. It's same-day surgery. Instead of going to have open spine surgery for recovery 4 to 6 months or a year, now the recovery is about a few days to a few weeks.
So it's almost like an outpatient treatment?
It's outpatient treatment. It has no muscle removal, no bone removal, and then
that's great.
Yeah, local anesthesia. It preserves the mobilities.
And pretty good success rates after this kind of surgery?
Yeah, success rate is very comparable with conventional spine surgery, especially for discal herniation, spinal stenosis, common conditions.
Doctor, thank you so much. Great information.
Thank you for having me on the show.
And if you want more information on endoscopic spinal surgery, just go to the website, AtlanticSpinalCare.com.